And we're going to make another musical chairs change of guest here as we wait for that moment to happen. And it looks like we are ready. Mr. Dean James is joining me now. He is the CEO of IMGG. IMGG is their stock symbol. Dean, good to see you again.
Good to see you too, Don.
Well, I know, I think it was last week, you basically got the paperwork off to the FDA, so that process has been renewed, as it were. Tell us about the process going forward.
Well, thanks, Don. Yeah, we're really happy that we finally got this phase done. I mean, we were late. I think we announced it to be, towards the end of August. It drug on because of the holiday weekend, and we wanted to make sure everything was complete. What we did was we sent them the imaging protocol package, along with some answers or responses to our NSE letter, or the letter that they rejected our 510K approval on, to try to go over the basis points of our 510K submission and what we want to do for our resubmission. The part of this process is really important because we can meet them in person, face to face, go over this issue by issue, and try to find some medium ground, so to speak. Not every issue is, a controversial topic for us to hammer out. Some are just, okay, this is what we're going to provide you. Is this going to be enough? Do you want some more detail? Others are going to be, well, we had this on our label. You didn't like that before. Should we, remove this, or can you tell us why you didn't like it? It's kind of like being able to get a direct access to, the review status group. The people that review the reviewer's product to give you the approval. So we're real excited about it.
I mean, do you feel like you're in a position now where you kind of know what it is they're looking for because of what happened previously? So it's almost like the movie Groundhog Day. You learn from day one what you don't want to do and what they're looking for, and now you can present exactly what they want?
Well, exactly, and this gives us even better than that. Now we can get that all confirmed up front prior to doing the submission. Now, our initial theory or our initial idea of how we were to approach this was do this towards the end of the process, prior to submission. We're doing this before we start building the submission and getting it ready, going out and grabbing images, and then meeting with them. If we do this up front, we don't have to go through a lot of legwork first. We can find out exactly what they want. And by the way, we just heard that we're actually going to be meeting with them in October. About midweek of October, we're trying to work out the schedule. We have 5, 6 consultants plus myself going at the same time, so it's going to, have to, juggle everyone's schedule. But, second week of October, I think we should be meeting with them.
So this is the meeting that everybody's been really looking forward to have happening. So it's going to happen next month in October. That's
absolutely.
Great.
We just found out yesterday.
Oh, congratulations.
Thank you.
Now, I know that you're going to the show in Chicago. I think it's right around Thanksgiving, if I remember correctly. You must be pretty excited about that, too. I mean, I know this October meeting with the FDA is, job one, but following that, right on the heels of it, is this big thing in Chicago.
Right, and hopefully if the world is perfect, the stars are aligned, we can have our 510K package submitted before that. But hopefully by the end of the year, I would be happy. The trade show, RSNA, Radiological Society of North America, is the weekend right after Thanksgiving. And we're excited. It's good to be out, out there promoting, saying we're still around. I mean, it's not as exciting since we don't have FDA approval, but it's still important to promote the product to our potential customer base.
Now, in your discussions with the FDA, are you feeling an atmosphere of cooperation on their end? Because I know that the rules changed a couple of years ago. You were kind of caught off guard by that administration change and everything else. Are you feeling more of a level of familiarity and more of a level of cooperation and genuine, I guess, helping hands from their standpoint?
Well, I do, Don. It's nice that you mentioned that. I mean, I think there's a dynamic change, not only just from their helpfulness side of it. They were very eager to have this meeting, and I was really shocked that we heard from them so quickly. I think it's only been a couple weeks. And I'm also very excited by the group of consultants that we have with us. The plan of action that we have, this 3-phase plan that we're trying to get this through the FDA. It's the 510K doesn't have a phase, but a phase process. But we built this process in the sense that we want to make this successful. We want to try to get, when we file our submission with the FDA, a yes. And I feel really confident in that. I mean, there's no guarantee, of course, but you know, the point is that they're, you know, very anxious to receive us and meet with us face to face to go over this. And proof is that we're seeing them right away.
I mean, correct me if I'm wrong, but you know, from the standpoint of what you're telling me, you're going to have these meetings, you're going to be getting everything together, you're going to discuss with them what it is they're looking for, what they need from you, et cetera, and then you're going to know what needs to go in this 510K. I mean, it's just a whole different situation than the first time.
Well, correct. I mean, there's no guessing. Now we're presenting, you know, every issue that they had with our package. We're going to go over point by point, you know, and address each of those, have an open dialogue between us, and, you know, this is what we think, you know, what do you think? You know, getting that feedback is really helpful, you know, with our imaging protocols. This is what we're, you know, we've huge document set up to, this is how we're going to do, you know, to acquire the images. These are the predicates that we're using. This is how we're going to compare them. These are the images, what they're actually going to be. This is the format that you're going to receive them in. You know, do you agree with this? You know, step by step. And if they don't, they say change this, change that. It's great. It's like getting the answers before the test.
Exactly.
You know?
Imaging 3, IMGG is the stock symbol. Dean, great update. Good luck with everything.
Thanks, Don.